Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, investigations in angina pectoris. So, in a patient with angina pectoris, ECG is the best initial test which is done for a patient with angina pectoris. ECG is usually normal, but it may show ST segment depression, and it will also show flat or inverse T waves are seen. It may show ST segment depression or flat or inverse T waves are seen. If the patient has resting ECG is normal, then we have to do an exercise ECG. If the resting ECG of a patient is normal, then we do an exercise ECG. This exercise ECG is nothing but you will ask the patient to go through the treadmill and we record electrocardiogram or ECG readings in such patient. So that is resting, uh, that is exercise ECG. So that is also called as treadmill test. Okay, this exercise ECG is nothing but treadmill test. So in the treadmill test, when do you say that the treadmill test is positive? So criteria for positive treadmill test. So if the ST segment depression is more than 1 millimeter and this ST segment depression of more than 1 millimeter is lasting for 0.08 seconds, or if there is systolic blood pressure is actually not systolic blood pressure, the fall in systolic blood pressure or the decrease in systolic blood pressure is more than 10 millimeters of Hg, or if the patient develops or there is development of sustained ventricular tachycardia, or if there are any signs of poor perfusion while the patient is exercising, like if the patient develops cyanosis or pallor during the exercise, or if the patient has ST segment elevation of more than 1 millimeter in leads without diagnostic Q waves, without any diagnostic Q waves, if the patient has ST segment elevation, so all this is positive treadmill test. Now, when the patient does exercise, actually what happens is when the patient does exercise, the target heart rate of the person will be almost 85% of maximum heart rate. The target heart rate during exercise is 80% of maximum heart rate. Now, what is maximum heart rate? Maximum heart rate is the maximum heart rate that the patient can reach during exercise or any time. So, this maximum heart rate can be calculated by the formula maximum heart rate is equal to 220 minus patient age. So, if you subtract patient's age from 220, then you get maximum heart rate. So, maximum heart rate should be around 85, not 80. It should be the target heart rate should be around 85% of maximum heart rate. Now, these are the criteria of positive TMT. There are also conditions where there is false positive TMT. The criteria when you say that there is false positive TMT or treadmill test is if the patient is taking digoxin even though the patient does not have any problem intrinsically, these criteria will be fulfilled. That is false positive treadmill test. Then if the patient has left bundle branch block or left ventricular hypertrophy in ECG, or if the patient has electrolyte imbalance, any type of electrolyte imbalance, or if the patient has some pacemaker. So in these conditions, there is false positive treadmill test is seen. False positive treadmill test is seen in 15% of cases. There are conditions where false negative treadmill test is seen. This false negative treadmill test is also seen in 15% of cases.
thank you and thank you for watching.